it's CJ. Have you been hearing a lot recently about shoulder dystocia? Not sure what all that means? Good news, you've come to the right place. Today I'm going to tell you what a shoulder dystocia is, how it might be managed in labor, some things that increase your risk for having a shoulder dystocia, and some things you can do that might help decrease your risk. A shoulder dystocia is an obstetrical emergency. It occurs when one or both of your baby's shoulders get stuck behind your pubic bone during a vaginal delivery. Once your baby's head is delivered, if the body does not come out within the next minute, your provider might suspect a shoulder dystocia. If they do, the following will probably happen. Number one, they will probably call out for some help. They may get a pediatrician and/or an anesthesiologist to come to the delivery room. Number two, they will reposition you to try to make as much room in your pelvis as possible. That's what's called a McRoberts maneuver. They will lay you flat on your back and bring your thighs up against your abdomen. Number three, they might cut an episiotomy to make more room. Number four, somebody, probably your nurse, will apply what's called suprapubic pressure. That is where they push down on your pubic bone to try to dislodge that baby's shoulder. And number five, if nothing else works, your provider will probably rotate your baby internally to try to get that shoulder unstuck. I am not going to lie, it can all be very, very scary for you. It can also be very stressful for your provider who's trying to get your baby delivered safely. So if your provider gets very quiet or starts yelling or starts talking very sternly, please do not get upset with them. Give them grace. They are scared. In the past, I have been involved in deliveries where there was a shoulder dystocia, and after the baby was delivered safely and all was said and done, the OB has walked out in the hallway and cried. They are people too. So, what are some things that can increase your risk for having a shoulder dystocia? If you have a baby that weighs 9 pounds or more, you have a 5 to 9% chance of having a dystocia. If this is your first baby, if you have a history of a shoulder dystocia in the past, if you are a gestational diabetic, or if your baby is coming down in a suboptimal position, that too can increase your risk. Unfortunately, most shoulder dystocias are unanticipated and we don't know why they happened. That being said, there are some things that you have control over, and so I do recommend you do the following. Number one, if you are a gestational diabetic, make sure that your blood sugar is well controlled. Number two, try to gain an appropriate amount of weight. If you gain excess weight during your pregnancy, that is another thing that can contribute to shoulder dystocia. Number three, if it is suspected that you are carrying a big baby who's in the 90th percentile or above, you might want to talk to your provider about having your labor induced sometime after 39 weeks. And number four, if you are at high risk for having a baby with a shoulder dystocia, you might want to talk to your physician about the risks versus benefits of having a C-section. I do hope that this information has come in handy. If there are any questions that I can answer for you, please drop those in the comment section below. And while you're in that comment section, I would sure appreciate it if you'd hit the like button and/or feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.